Hey guys, so today we're talking about pelvic floor. This guy right there, all of that. Oh, I can't even get it. There we go. Bam, 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 bam. So, Taji asked me about pelvic floor exercises today. Not going to give the context of why. And so I figured, hey, let's do a video on it because I haven't done a video on pelvic floor before. So she said, oh, I had some exercises from PT, whatever, and then I asked her to describe them to me, and I was like, I got some better stuff for you. So Tasha, why don't you show me what you learned before on pelvic floor exercises? Can you demonstrate what you remember?
Yeah. You want me to do it on the floor? Or you want me to do it
on the bench. By the way, what are the pelvic floor muscles? The pelvic floor muscles are all the muscles that surround your anus, vaginal canal if you're a woman, and obviously not the vaginal canal if you are a male, like myself. So, what are you doing? Show me.
So one thing I learned is that you have to breathe and contract your muscles.
Speak louder.
So breathe and contract your muscles. So exhale and inhale, contracting. So inhale, push out your stomach, and then exhale.
So contract your navel to your spine.
Yes, so learning how to do that again.
So,
and then another one that I learned was just doing these.
Okay. You guys see what she's doing? She's breathing in all the way. We're gonna make this a little closer, and then she's sucking her navel into her spine. Okay? Good vibration, okay? So she's breathing in, she's sucking her navel to her spine, and the other one, come on up.
Here, bridge, and then you could do one leg, or the kick out.
Okay.
That's one thing I learned. And then another one.
Wrong.
Okay, well, another thing that I learned was doing what are these?
Wrong. I mean,
okay,
yes,
well, you do these too.
All right, let's see it.
These?
Okay. The low bear.
Yeah.
So all of those technically would work in your pelvic floor, but if your pelvic floor is weak or dysfunctional, that wouldn't work.
Well, honestly, because I was looking at exercises after prenatal, so that's probably why. Because I thought I had diastasis recti. I don't know.
You don't have diastasis recti.
Well,
I do.
I thought I did.
I haven't even had a baby, and I have diastasis recti. All right. So what she demonstrated was some basic pelvic floor exercises you might get from Google. Pilates, whatever.
Don't hate on the Pilates. Pilates actually does work. Thank you.
I didn't say anything about Pilates, okay? Anyways, lay on your back.
Okay. This way or that way? This way?
Yeah.
Okay.
So we're gonna bring this a little closer. Maybe. Okay, so I'm gonna teach her how to access her pelvic floor. But first, we have to sing the Stop, Don't Touch Me There. This is my no-no square.
Oh.
Do you know that song?
No. I'm trying to figure out how to get this.
It's no-no square.
Oh, okay. Yeah. Don't touch me there, please.
Really?
Yeah.
Seriously?
Yeah, seriously.
Then I can't show you this exercise. So you really want to
Didn't you just say we have to sing that?
Oh.
That's what you just said, right?
Well, we have to sing it, and then I'm going to touch your no-no square.
Okay.
Okay, so the pelvic floor is these guys' muscles in here. So if you're just breathing in, and you're contracting your navel to your spine, that doesn't necessarily mean that your pelvic floor is contracting as well, okay? So bend both legs, bend both legs.
Oh, I also did tabletop. Is that one?
I mean, all of those, yes, all of those are gonna be pelvic floor exercises, but the majority of people that have pelvic floor dysfunction won't be able to do those exercises and actually access their pelvic floor.
Oh, okay.
So they're doing the exercises, and those are decent exercises, but a lot of times they're not accomplishing the goal, which is to access the pelvic floor. So what am I gonna do? Oops, sorry. I just crushed her knee.
He got my knee again, guys. Now I'm gonna be hurt.
Abuse. Okay? Patient abuse. Anyways, so we're gonna touch her pelvic floor on the inside of her ischial tuberosity, and we're going to see if she can access it. Okay? Get right in here.
Okay.
Okay? Now, try to pull the musculature right there away from me. Almost like you're sucking it towards your nose.
Like contracting my butt?
No. You should be able to contract your pelvic floor without contracting your butt muscles.
So this right here.
Ignore that for now.
Okay. I'm confused.
Just pull your pelvic floor to your, okay?
I feel like I'm using my butt right now.
You are using your butt. Push your knee towards me. That way. Hold. So her issue is she can't engage the pelvic floor without contracting the glutes, which is not the goal. We should be able to contract the pelvic floor like you're sucking a straw through your butthole, rectum, and you should be able to do that without your adductor muscles kicking in or your glute muscles kicking in. If you're not doing that, then you're not accessing the pelvic floor the way it's supposed to be. Okay, so we're gonna get right back in here. Suck a straw with your anus. There you go. Now hold that for 30 seconds without contracting your glutes.
Y'all don't want to know what's really going on with me right now, actually.
So I'm going right on the inside. Keep doing it. Don't stop. Good?
Yeah.
Oh, fun. Okay, so here we are. So this is the inside. I was right in here, and right in here is your anus, and right in here is the vaginal canal. So I'm going right here in the musculature that goes from the tailbone. We'll come back to you in a second. Okay, so you just try to figure out how to suck air through a straw that's in your anus. Yeah, it's a cue. Don't make it dirty. So the musculature is all in here, right? So we need to be able to contract this muscle without the big glutes kicking in or the adductors kicking in. If you can't do that, then the exercises that she just showed before are relatively pointless, and you're not going to truly be accessing the pelvic floor. You're going to be mostly you're going to be compensating, essentially. Okay? So the cue, do we have a straw?
Do we have a straw?
I think we have a straw.
I don't know. Hi, guys. I don't know what Trevor's saying. I keep seeing it. Ooh, my head. I was trying to lay down in this ponytail, and it's so uncomfortable, by the way.
Okay, so apparently all our straws got thrown away. So what you're trying to do from a visual, because visuals do help, here's your anus. This is a straw. It's actually a pen. It's like you're contracting, like you're trying to suck air through the straw, through your anus, to bring your pelvic floor.
Should I try to go like I'm sucking a straw?
No. On your back.
Thought that would help.
I mean, maybe from a neurologic visualization standpoint, you could try it. Lay on your back. So we're going to get right back there to the pelvic floor. My finger is on her pelvic floor. Confirm it's on your pelvic floor, yes?
It definitely hurts.
Yeah, so it hurts.
It's there.
Okay, so now suck that straw. It should go, yes, good. It should go towards your nose. The muscles in your pelvic floor.
Am I doing anything with my stomach though?
That's the next step. Let's just focus on this.
Okay.
So hold it out. So before you progress to the next exercise, you should be able to hold your pelvic floor like you're sucking a straw up for 30 seconds minimum.
Okay.
And the muscles are on both sides, so you have to check both sides. You're doing okay here. So hold, hold, hold.
Okay.
Hold, hold, hold. And it's starting to quiver a little bit. A little bit. Okay? Other side. Right there. Can you do this side? Huh?
I think I'm doing it, yeah.
This side's weaker, so the right,
Definitely.
left.
I'm sure this side is going to be weaker because this is my weaker knee. It's my weaker side.
Somewhat. Suck that straw.
I'm trying.
And then I'm massaging the muscle to neurologically turn it on. It's called goading. Suck that straw. There you go.
I've worked on my legs and stuff today, guys, so that's why I'm so sore.
You worked on your legs yesterday.
Oh, yeah, yesterday.
Suck that straw. It's like here.
Okay.
Like right here. You're trying to suck these muscles. They go from your tailbone, all these guys in here, trying to suck them towards your nose.
Okay.
Okay, are you sucking it up?
Yeah, you see my legs are shaking.
Yeah.
I don't know. I think
Relax your
I'm
glute.
bleeding.
Relax your glute.
Okay, okay.
Relax your glute.
I'm confused. I don't know how to do it without getting my glutes activated so much. Like, what's the difference? Because I'm clenching my butt, right? Is that basically what I'm doing?
Yeah, but you're not going to be able to, if you are clenching your butt, you're not going to be able to access those muscles
Like,
when you
let
do.
me show you the difference of what I'm doing. Okay, go. So this is me clenching my butt.
Mhm.
And then I think the other one.
So the first one, you were clenching your butt.
Yeah.
Your pelvic floor actually relaxed.
Okay.
For the second one, you actually contracted your pelvic floor. So the first one was just butt contraction, gluteal activation. The second one was pelvic floor.
Is this pelvic floor?
That's pelvic floor. Nope, nope. Go. Yep, there you go. Relax your glutes though.
Okay.
So hold it, hold it, hold it. So once you get that, then we can act. The TVA and the pelvic floor are neurologically linked. So you can't contract one without the other. So technically, what you were doing before was okay.
Basically, I need to do Kegels.
Kegels are just one aspect. So now, if you can hold that for 30 seconds each side, which you can't on the left, but we'll progress just for pretensies. Now, suck that straw, both sides. Suck your navel to your spine. Hold them both. Now bridge up, like you were doing before. See how that feels different?
A little bit.
Suck harder. Okay. Straw in. Okay. This is already past your capacity to do correctly. Because you're not able to keep this strongly sucked.
I'm not.
Yeah. So down. So ideally, we'd be able to hold the pelvic floor for 30 seconds of just contraction by itself. Then we'd add in the TVA and the pelvic floor at the same time.
Mm-hmm.
Then you would come to a bridge. And you'd have to make sure you maintain this and this at the same time. Then you'd be able to do those exercises you did before.
Yeah,
Because you-
I'm falling out of it.
Yeah, because before you were using your glutes to do the work.
Okay.
Now we're trying to get the pelvic floor to do the work with the TVA.
Yeah.
And like you wouldn't want to exercise like this for fitness, but you exercise like this to increase the strength of the pelvic floor.
Okay.
Does that make sense?
Mm-hmm.
Questions? Oh, people are really like just trying to roast your hair right now. People
They're
are,
roasting my hair?
yeah, somebody's saying, Dr. Dean's so cheap, I can't pay for you to do your hair. What's wrong with your hair? Looks beautiful.
I don't know.
They're just haters, you know, guys. Just haters. Just.
Maybe because I made a comment and I looked at my head, I said, oh, my hair looks crazy right now.
Wow.
Because it was like, it was over or something, I don't know. But well, it's only because I'm laying down right now.
Yeah, yeah. Anyways, guys, this is a clinical video. The people that have mental health disorders and people that just spend all their time on the internet, they're probably poor. They probably don't have lives. They're probably mad at someone. Like, they really are miserable people that, you know, they just are what they are. Let them just sit there, build your brand. Like, they need to seek Jesus. They need to read a Bible. Anyways. Why does she have to strengthen her pelvic floor muscles? Well, she had a baby. Like, that's a good reason to strengthen your pelvic floor muscles, because they get all stretched out after pushing the head out, you know? You know, that kind of stuff. Hey guys, we're sitting here talking about pelvic floor dysfunction, and you guys are talking about someone's hair. She has beautiful hair. And yes, I pay for it. Dumbasses. I've pale been when I stand up from sitting. Is that a pelvic port? It can be. You can try these exercises. Tailbone pain, like urinary incontinence, painful sex, that kind of thing. If you feel like you can't hold if you feel like you have to pee and then you have to pee again 2 minutes later, this is a great place to start. Pelvic floor dysfunction, you know? Anyway, Sasha, are you sucking that straw up?
Oh, no, not right now. I was just chilling.
Yeah, suck that straw. Suck that straw.
Okay.
Do it.
The straw in the stomach?
Okay. Yeah. Go ahead and practice it. Somebody's asked, how do you know if your pelvic floor is too tight versus too weak? That's a good question. Mostly I can tell by touching it, by actually assessing the tissue quality. Too weak, too tight, based on your symptoms. Usually people with too tight a pelvic floor, they tend to have more painful sex. People with too weak, they tend to have more urinary issues, that kind of thing. But there's an overlap between the two, so it kind of really depends. For her, she has good activation on the right side, but not the left side, so we need to work more on the left side. So that was a great question. And yes, guys, you can use this for tailbone pain. Women that want to strengthen their pelvic floor, this is a great way to do it. This is better than Kegels, in my opinion, because it goes more along with neurologic function of the brain. Why does she have to suck the straw? The straw is a cue, right? If I say suck a straw up your anus, she instantly knew what to do because she formed a visualization in her mind that's called an external cue, and she instantly contracted the muscles properly. Versus before, when I said draw your pelvic floor up or contract, she didn't quite get it. But as soon as I gave her a very dramatic visual in her head, then she instantly did it. And no, I don't use that reference with patients that much unless I know them pretty well, but I would use other cues. What can men do for the same kind of thing? The pelvic floor is the pelvic floor. Just because you have a vagina versus a penis, it doesn't change the function of the pelvic floor. So the exercises I'm showing you would be the exact same for a male. So having an external dangling genitalia does not change the function of the pelvic floor that much. It's a little different, but you still exercise it in the same way. Somebody says, I had 5 children. I'm always exercising my pelvic floor. It's important to do, so I have problems later in life. Yeah. A lot of women, especially after C-sections, that kind of thing, don't realize how much you need to re-engage your core and your pelvic floor and everything else to maintain proper function of the pelvic floor. It's a muscle just like anything else, and it's really easy for those guys to get weak, especially in sports like distance running, pregnancy, that kind of thing. Can pelvic floor dysfunction come from having a hysterectomy? Absolutely. I mean, any sort of abdominal surgery, any sort of pelvic surgery, any sort of pelvic pathology can affect the pelvic floor. So yeah, even organ function can affect the pelvic floor. So the pelvic floor is it's like a trampoline. Your diaphragm comes from the top, and it's like a parachute, and it pushes pressure at the contents of the organs and the fluids in the abdominal cavity down, and then the pelvic floor at the bottom is like a little trampoline, like a kid standing on it, and it expands downwardly. So the pressure needs to be able to reach your pelvic floor. Your pelvic floor needs to be strong enough to resist that pressure and provide some counter resistance to create inner pressure in the abdominal cavity called inner abdominal pressure. Is it the same muscle we could use to poop when in labor? Considering you just said you had a baby. Yeah, it's the same muscle you would. Yeah, sort of. Yeah, it's related. Contracting your pelvic floor will make you interesting stuff happen. Can it contribute to scars and constipation? Definitely can it contribute to constipation. I mean, all this. Like when you get in the abdominal canal, everything is basically related to everything. The diaphragm needs to be able to push downwardly. The pelvic floor needs to be able to resist it to circulate fluid within the abdominal canal. So if that's off, the fluid dynamics in the abdominal canal can be altered and cause digestional issues from, lymphatics and that kind of stuff. What do you do for a stiff neck and back from a computer? That would be a different video. I work in PT. We have a new patient with torticollis next week. Be sure to check the meninges and the brachial plexus. A doctor, I am a chiropractor. Legally, that is what I do. Does a weak pelvic floor cause uterine prolapse? That's certainly a factor, obviously, but also the ligaments that support the uterus are part of it. So yes, you can do it for men. For some, last time my child's turned 20, but in the past year, every time I cough or sneeze, I pee myself. Is there anything I can do to fix this? That would probably be a weak pelvic floor. This exercise is what you need to do. There could be some neurologic issues and some bladder issues, but you still need to do this. So yeah, this is exactly the kind of thing, so this, I'm not going to say her name, but this lady's saying she's 47 and she's had 3 kids, and now it's 20 years later and she's starting to have some urinary issues. Yeah, so a lot of times when you have a weak pelvic floor, it doesn't start showing up problems until later. Probably don't get it, but it's funny. Kansas City Chief vibes. Do I look like a Kansas City Chief? Tasha, you don't have to lay there unless you're practicing. What are you laughing about?
I'm laughing at what they said.
Because I'm a Kansas City
Chief vibe.
And then somebody's like, he's a Viking. No, I'm definitely a Viking. I'm like, what are you laughing about?
I just messed my hair up, y'all, because I laid down. That's what's going on with me.
Right. Somebody said I'm so cheap I can't pay for your hair to be done. Is that true?
No. No.
Oh. The refs are helping him win? I don't know. Something's going on in Kansas City right now. I have no idea. I don't watch sports. Any other questions related to sucking a pencil up your butt for pelvic floor? That is the cue that works the best. Would it be better to see a chiro or a pelvic floor specialist to help with PVD? Depends on the chiropractor, but in general speaking, you'd probably be better off seeing a pelvic floor specialist. I just happen to study everything in the body, so I do everything. But in general, you'd be better off seeing a pelvic floor specialist. I do everything with the pelvic floor except for go internal. I don't do any internal work whatsoever.
I want to know if you update your website because you're with me now.
Update my website? Why are you guys so concerned about my website? That's work, man. Time. Time is money. I don't have that much time. Yeah, I do need to do it, but I just, I'm not going to do things to please people on the internet. I'd rather give the haters lots of content so that they can spread my name and build my brand for me. Does a weak, poor posture contribute to pelvic floor? Can be, yeah, for sure. Poor posture puts your spine out of alignment and causes all kinds of things going on. Natasha fell asleep. She was working on her pelvic floor. How long and how many times do you do this exercise? This is a little bit different. The reps and sets depend on how many you can do perfectly. So start off with the 30 seconds of contracting your pelvic floor muscles, and wait until and let's do 3 to 5 reps of that in a day. And then once that becomes easy and automatic, and it's not difficult, and it's not straining, and it's not quivering and shaking, then you would move on to the the next exercises, which is sucking in your navel, so TVA, transverse abdominis, and the pelvic floor. And you can do it in any position. It's just easiest on your back. Like you could do the same thing right here if it's easier for you. There, and then.
And then what?
Suck your pelvic.
Oh, okay.
The straw. Suck the straw.
I'm doing it, I
Okay.
think.
Okay, good. Touch yourself. Somebody says, please unblock me. I
Oh,
don't
it
know.
got blocked?
I don't usually unblock people when I block them. I usually block them for a reason.
Put Todd on your main profile.
Yeah, it's because I need to change some websites on my some photos on my website, and they're just.
I haven't even looked at your website, to be honest.
Me neither in a long time.
So this is news to me.
It's because I still have some pictures
Oh.
of my ex on there, so, and I just don't care because I'm not on social media to participate in this drama that you guys like to create. I put my money and resources in protecting myself from lies versus changing my website.
List your coffee link, they said.
Sure, I'll put my coffee link in the comment section. Any other question for?
Who is that? Someone said unblock me.
I don't know. You can look at it later on. Like usually when people say, like unblock me, they usually said something nasty, but they still want to watch your content. Show the exercise one more time.
Naughty, y'all, naughty.
All right, show the exercise one more time. Lay on your back.
Oh, Lord, y'all want to put me to work.
Well,
Okay.
you can do it right there. Do it.
No, it's fine, it's fine. I'll lay down because I don't think I was doing it correctly anyways, so.
Well, you were.
I wasn't?
That's why I said you can't do the other one properly because you weren't doing it right.
Laying down?
Yeah.
Oh, I wasn't doing
On
it.
this side, your left side? No, you weren't.
Oh, okay, well then.
No, you can do it that. You
However you want me.
do it that way. Lay on your back.
Okay.
Work on
However
your
you want
left. Work on your left side. Bend your knees.
it. Okay.
Bend your knees. Okay, so only focus on this left side because you need to be able to hold this contraction right there. Suck that straw. There it is. And you need to be able to hold that without it letting go or like, you know, like turning on and off, quivering for 30 seconds before you can progress to the next exercise. So she's sucking in her pelvic floor this way, like towards her nose, without contracting her glutes or the adductors on the inside of the leg. Once she can do that, then she does that at the same time as sucking her navel to her spine. And then you should be able to hold that for 30 seconds. And then once that gets easy, now you can advance to more advanced exercises. But most people, it's going to take them a couple weeks, maybe 6, to even get past this stage. Because a lot of times the pelvic floor is pretty weak and it's really hard for people to access it in training. It takes a lot of cognitive. That's why I use this silly suck the straw up, because it makes it a little comical and it gives you a sort of a dramatic mental image that makes it happen. You doing it?
I think so.
Put your fingers right up in there.
I'm putting my finger here.
Right on the inside of your sit bones.
Okay.
There. Push or contract. Like
I'm doing
suck
it.
straw?
I'm sucking.
Okay, good. You are doing it.
Yeah. It's just hard for me to differ me actually sucking the straw and feeling my quads. Because I feel my quads every time. That's why I'm saying.
So that's what we're trying to stop. You should be able to contract your pelvic floor without the other muscles kicking in. So that's what you got to work on, is getting your pelvic floor muscles to turn on without the other ones. That's why it takes a really long time to progress this exercise, because most people can't do it without squeezing their glutes or squeezing their quads or their adductors. And we want those muscles. We want to be able to use the pelvic floor muscles by themselves before.
Okay, I'm squeezing my glutes right now. Look, right? Watch.
Yeah.
That's me squeezing my glutes, and this is me doing it. So basically, if I'm doing it or overdoing it, it's me squeezing my glutes.
If you're not doing it correctly, you'll squeeze your glutes. Exactly. Okay, guys, that's it for today. At least on this subject. Say bye, Tasha.
See you later, guys.
I can't see it. There you go. All right. Bye.